United States has had since 1963. We know, as you have just heard Dr. Kaiser talk about, that there is a lot of fear and concern across the United States about novel coronavirus. Many Americans have seen some images from China that have made this fear seem to escalate. And we understand that there's a lot of concern around novel coronavirus in China. We want to make sure, though, that you understand there should be no concern about novel coronavirus from these 195 individuals. They have been watched more closely than anyone else in the United States at this point in time. We also want to make sure that you understand that throughout their stay, as Dr. Kaiser mentioned, the individuals have been kept completely separate from all of the staff at March Air Reserve Base. They have maintained their place within a cordoned area that was fenced off, and that's where they have conducted all of their community activities. The individuals who work with them, such as myself and our CDC staff, the Riverside County Health staff, and other healthcare professionals, have also taken the proper personal protective equipment procedures during the course of their quarantine period. In order for this to have functioned properly, it really took all of us here to make this quarantine work successfully. It truly is a public health system. That system from the local level to the state level to the federal level, and across all of the different partners that were involved. This would not have worked as well as it did without all of those organizations playing their appropriate role and doing it successfully. I think it's really important to recognize what we have achieved here together in Riverside County. We have successfully conducted the first quarantine in almost 60 years. We have done that in a way that protected the evacuees themselves. We have done that in a way that protected all of the community members here in Riverside, and in a way that ultimately led to the protection of Americans all around the country. As we have said since the beginning of this outbreak, this has been a rapidly changing situation. The experts at CDC and in organizations around the world have been watching this virus and watching its movement and monitoring it for changes since the epidemic began. At this time, we continue to believe that the risk to the general public within the United States from novel coronavirus is extremely low. We will continue to work with state and local partners, not only here, but across the United States, to ensure that we are keeping the public informed and that we are taking every precaution and every measure that is necessary through our public health practices to keep America safe. Thank you, and I will turn back over to Jose.
Okay, folks. Okay, everyone. We got some questions.
Question. Discrimination has been a significant problem, and we are doing everything we can to educate our evacuees, provide them with information on how to access mental health services should they be needed, and also to educate the communities. These people do not have novel coronavirus. It is important that they go back into their communities and that they be accepted in those communities.
Yes.
Comment, and then if some of the other partners would like to as well. Yeah, I think that we have a number of lessons learned here from the quarantine period. One thing that was really important was our communication, not just across all of the organizations, that were collaborating to effectively implement the quarantine, but also with the evacuees themselves. We needed to have regular communication with them so that we could hear what their concerns and their needs were, and they could hear from us the updates that they needed to be provided about themselves as a community and about what was happening around them. So that was an extremely important point for us. March Air Reserve Base is one of those sites. There are several sites that the Department of Defense has identified around the United States that could serve as a backup site to receive travelers that are arriving through these funneled airports from flights in China. So it is possible that they could receive additional travelers.
Anybody else? Yes.
Yes, we have had 3 passengers from LAX during the course of this period. Of those, because their quarantine period is based on their departure from Hubei province. So one of those 3 already successfully completed the quarantine period and already left the base. We have 2 others that are in the process of completing their quarantine period and are being monitored just as we have done for our 195 evacuees. I think another important point to note is that the way in which the base and our incident management team have worked here is that the space where the travelers are being housed has been completely separate from the space where our 195 evacuees were housed, so that we were not mixing individuals that had different quarantine periods and quarantine dates. Regarding questions around that particular case, I would ask you to talk to our headquarters experts as well as our team that's there on the ground. We have a team there just as we have here. Talking about the testing capacity overall, the CDC received approval from the FDA for the test to be able to be sent out to to approved labs within states, so that states will have that testing capacity locally going forward.
Yes. Go ahead.
The question is around the duration of the quarantine period, and that being 14 days. Because this virus and this outbreak is continuing to evolve on a daily basis, we have experts that are monitoring the information about cases as they arise. That information includes looking at when the symptoms onset was and when they may have had any previous exposures. So through using that information, we are comfortable with the 14-day quarantine period being long enough to capture the incubation period for this virus. The question is around symptoms from other travelers. We have not had any symptoms from our other travelers here on the base. If we were to have symptoms in any of the travelers, they would follow the normal procedure. The symptoms we look for are things that you can see from other types of infectious diseases. It's fever, it's cough, and it's shortness of breath. So when we see anybody like that, our process would be to isolate them, to take them to the hospital where they can be evaluated, not only for novel coronavirus, but also for other potential infectious diseases that can cause those symptoms. And then once the test is confirmed back negative, then we can return them to the base.
Amy?
So the question is around the 2 individual travelers that we currently have on the base. Those individual travelers have the same quarantine date. They arrived on the same flight.
Anybody else? Over here, Dave?
Yeah, so the question is around the fear and stigma, and particularly those individuals that are working on the base. I think it's really unfortunate that the workers at the base have had to endure this fear and discrimination in their communities here. We've met with these workers and had town halls with them to hear some of their questions and their concerns, and we've heard things like someone's a young girl, their daughter, being discriminated against and called names at school when she went into school because her mom worked at the base. We heard another employee who was denied housing because she worked at the base. It's really important, and we can use all of your help in helping us at CDC and helping the Riverside Health Department on making sure that Americans understand that when someone is quarantined, they are being very closely watched. People who are going in there with the strictest of precautions, and other people, if you're more than 6 feet away, there is no risk of contracting novel coronavirus. So all of the workers here, they have been far away from that quarantined area and have absolutely no risk to them. Question is around individuals at the very beginning of their arrival here and potential departure from the area. I think, we were still learning at that time as well, and our recommendations evolved during that time. When they first arrived, we did not institute a quarantine immediately. And as we looked at the outbreak that was occurring around the world, we decided it was in the best interest, not only of these individuals, but of the community here and the American public, to implement a quarantine order, not just for this group of travelers, but for anyone who is arriving to the United States with having travel history of being in Wuhan province in the last 14 days before their arrival. So that individual was acting in a way that she thought was appropriate at that time, and our measures changed based not on her, but based on the outbreak itself. So your question is around instituting quarantine and the fact that we haven't done it in such a long time. Does it pose any difficulties for us? I think this outbreak and the response that we as CDC have had to this outbreak is quite significant. We have more than 800 people at CDC who are working full-time in one way or another around this outbreak. Individuals like myself and my team members here who are out in the field as well as at headquarters. We have more than 260 people who are out in the field. So the impact as an agency and our response to this outbreak is very significant, including the implementation of these quarantine orders. I'm not quite sure what you mean by Plan B. So talking about the risk to the United States currently being low risk. That's why we have implemented the very aggressive stance towards quarantine and, for individuals who are arriving having had travel from Hubei province within the last 14 days. In addition to that, anyone who is arriving from other parts of China, from mainland China, they are being actively monitored when they go back to their home of record, and they are being provided with information about those symptoms to watch out for: fever, cough, shortness of breath, and how to reach out to their local health departments should they develop any symptoms. So your questions around follow-up for our 195 travelers who are leaving the base today. They don't need any additional follow-up as it relates to novel coronavirus. Now, if they have other health conditions, hypertension, diabetes, normal care, of course they will require their normal care. But as far as it relates to novel coronavirus, absolutely no follow-up that is needed from here on out for them.
Good afternoon, everybody. My name is Jamie Faust. I'm the U.S. Consul General in Wuhan. Wuhan Consulate is responsible for the provinces of Hubei, Hunan, Henan, and Jiangxi. That area in central China is about this, has a GDP and population of Brazil, so it's quite a large area. Our consulate was responsible for the evacuation of the first plane of American citizens who departed. We had the help of our embassy in Beijing, who helped to create the manifest of passengers. We had the help of Washington, D.C. Task Force, who helped to organize this. It was a real team effort. It was an amazing, it was a little bit different type of departure than you would normally see when you go to an airport. We basically had to do it ourselves. We had to check the passengers against the manifest. We had to check their bags. We had to load them onto the plane. We had to make sure that everybody was healthy, did not have a temperature, and could travel. We received a really warm welcome here at March Air Force Base, and I'd like to read off the number of organizations that did take care of us. They showed us their kindness, their humanity, and their charity. The first is the Department of Health and Human Services, the Administration for Children and Families, Centers for Disease Control, U.S. Public Health Service, the Assistant Secretary for Preparedness and Response, Department of Defense at March Air Force Base, the U.S. Marshals, the officers and spouses of Consulate Wuhan and the embassy and Maine State, and the Department of the State of Alaska and customs officials who welcomed us. I must say that the CDC was extremely professional. They were organized. We appreciate the communication that they had with us. Everybody felt like the quarantine was their civic duty to do what they need to do to keep themselves and their communities safe. The quarantine was something that, when I first imagined, was going to be a challenge for everybody, but it turned out to be much better and easier than I and most everybody that was with me imagined. So thank you very much, and if you have any questions, I'll take some questions. It wasn't a panic. We had several days to plan for it, and as we were getting on the plane, It was a little bit strange because it's a cargo plane with no windows. We had men in hazmat suits who were welcoming us, but I think everybody felt like once we got in the air, everybody felt a sense of relief, and it was a very nice flight. There's nobody left at the consulate. As soon as possible. Well, when the number of cases started to increase, and then the city of Wuhan started clamping down on transportation and services, we became concerned that it was time to close down the consulate. We have a list of decision points, and we went through that with Embassy Beijing, and each one along the way we said yes, we believe that we have crossed this threshold, and it was now time to close the consulate. I can't, I don't know. I'm sorry? Oh, sorry.
Case in San Diego. They were asking about the case in San Diego.
Yeah, I think that another gentleman asked a similar question earlier regarding the case in San Diego. We are focused here on our team at March Air Reserve Base, so I would ask that you talk with the team that is on the ground there at Miramar, as well as for CDC, our headquarters in Atlanta.
All right, we have time for a couple more questions.
I'll leave that to our CDC colleagues to comment on that. I know that the Chinese government is doing the best that they can to try to control the spread of this virus, and they do things a little bit differently than we do. But my heart goes out to the people of Wuhan, and we appreciate the support that the government gave us to leaving.
One last question.
Well, I have to say that today, as we took off our masks, and we're given a clean bill of health, we all realized that we had gone through this experience together, and we made good friends. We kept ourselves busy. One of our staff did a Zumba class. We had trivia games. We had a master artist who gave art classes. The kids had a school. We tried to do as normal of a life as we could. It was actually quite a good experience, and we hope to have a reunion soon. I'm a very emotional person. I cry easily. So.
Thank you very much, everybody. Dr. Knight and Dr. Kaiser will be here for stand-ups if you want. The General Counsel has to leave right away, so appreciate it very much. Thank you.
Can I make one more comment?
Oh, yes, I'm sorry.
I just want to say one last thing. It was really exciting after everyone got their final health check done to see them celebrate, throw their masks in the air, and to be able to hug everyone and take lots of selfies. It was really exciting.